today's society, life revolves around technology. Smartphones and laptop computers are just a few of the electronics that we use in our day-to-day life. Hospitals also use a great deal of technology, such as electronic health records. It is no question that technology makes hospitals more efficient. Technology has become so advanced and is being used more and more in the health field. Most of the time, robots carry out tasks that nurses easily can become overwhelmed with, especially in the shortage we are experiencing. These are a few examples of how robots used in healthcare can be advantageous to nurses today.
It has been a long day at work, 2 nurses called out, and each of the working nurses got extra patients. Our nurse here has been running from room to room trying to keep up with the needs of each of her patients and keep her charting up to date. She has a long list of things she needs to get done, and she just remembered she needed to check one of her patients' vitals and chart them. She goes into her patient's room, checks the vitals, and has to go chart them before she can move on to her next task. What if there was a way that the vitals could be checked and charted without the nurse having to do it? The nurse aiding robot is programmed to go into a certain room and has a list of vitals programmed that it must take. The robot accurately takes the patient's vitals and they are automatically added to the patient's electronic chart through the amazing advancements of technology. This allows the nurse to continue with all of her other tasks, feeling comfortable and confident that the robot will do a superb job while taking vitals, along with performing great communication skills with the patient. The nurse is automatically able to pull up the patient's charts and stay updated with the patient.
Before robotics, nurses take care of patients post-surgery, performing tasks such as changing dressings. Many nurses feel like they have too many responsibilities and too many patients. In the cases of post-surgery care and dressing changes, the patient needs someone very careful because they are at an extremely weak point. If nurses are being rushed in this environment, it only allows more room for human error to occur. A nursing robot walks into the room and introduces itself to the patient. It then begins to change the patient's dressing from where they just had surgery. With robotics, the robot can perform post-surgery care like dressing changes swiftly and can efficiently care for multiple patients faster than a human nurse could. This allows the nurse to spend more time with patients who need more immediate attention, such as those in the ICU.
My mother was a little skeptical at first of the robot, but after the nurses and doctors reassured her that it would take the best possible care of me, she trusted it, and we are so glad that she did. I did not see the nurse as much as I usually do because the robot came and took my vitals and changed my dressings and did all of that, but the nurse was still always available to me when I needed her for comfort or questions or anything like that.
Being a nurse is a stressful job. Throughout this video, you were able to see just a small look into a nurse's world. With the nursing shortage continuing to expand, more pressure is placed on the nurses to complete more tasks in the same amount of time as they had before. It becomes a very hectic environment. With the help of nurse-aiding robots in healthcare, nursing efficiency is greatly improved. The nurse and robots work together to create more patient-centered care. Stress is relieved from the nurse because they are receiving help throughout the day to complete their tasks and responsibilities. All in all, the robotics being used in nursing creates satisfied patients and improves the efficiency of nurses.
Help! I need somebody. Help! Not just anybody. Help! You know I need someone. Help! When I was young, there's almost